I first came to Kumi Hospital in 2007 as a volunteer physiotherapist. I think the ethos of Kumi and the people here who've got a real heart for providing quality care, and it's serves such a large community that we really want to help serve that community as well. I've seen a lot of charities come and go. We just wanted to have something that we could actually have in partnership with the hospital to let them provide the care that they want to provide. We're looking at infrastructure and staffing, training of staff, development of staff. It's a very complex problem, and something that we looked at to try and help deal with it is incentives to staff. Most people have children and quite often have a lot of children, and their wages don't cover anywhere near the cost of the school fees for the children. And so what we've been doing is giving grants which are awarded for a year, and they essentially look at the staff who are struggling the most. In the UK, we're used to healthcare assistants, people who are employed by the hospital to care for us, to look after us. Here you have to bring someone with you, and quite frequently you bring half a family with you, and there's just not enough space to actually accommodate all those people and all their belongings. And there were huge infection rates, so we wanted to have somewhere that they could come, prepare food, be together, get out of the rain when it pours with rain, and this was something that we did as a project in 2009, and it's had a real success. The next really big project that we want to focus on is around nursing training. The lack of sufficiently trained staff is not just a problem from this hospital, but it's a wider issue within training in this country. We're looking at developing a training school here at the hospital to train the nurses who are from this hospital. We're also taking in and providing training places for more nurses from around this region. And then in addition to that, we would be essentially providing a self-sufficient form of income for the hospital. For me, being able to provide affordable healthcare to people, whatever their income, however poor they are, is really, really important. And this hospital has a real heart for providing care, not for making a profit. It calls itself a not-for-profit organisation, and they don't turn patients away. Anyone who has an appreciation of the health service that we have in the UK, then this is a good place to look at supporting. As a charity, we are really keen on making sure that all our money is spent here on the projects, and so we pledge that we will spend 90% of any income that we get in here in Kumi Hospital.